The following audio may contain the personal testimonials of some OPTAVIA coaches or clients of OPTAVIA. The results relayed in these messages are based on the unique experiences of the participants, and we cannot guarantee like or similar outcomes. While you may be inspired by these accounts, please note that any stories of success have not been verified and your individual path to optimal health will vary. As always, it is our recommendation that you consult with a healthcare provider before starting a weight loss program. Yours in health, the OPTAVIA team.
October is National Breast Cancer Month, so hence my topic of breast cancer. So I'm very excited to have all of you join in. Okay, so good evening, everyone. We are going to get started now. My name is Delia Garcia. I am a medical doctor. My specialty is breast cancer, and I'm also very, very honored to be a certified OPTAVIA coach. So my topic tonight is breast cancer, most of what you need to know. So I'd like to begin with my background. As I mentioned, my background is that of breast cancer. And so I started my practice in 1983. And in 2011, I retired from mainstream medicine to do health coaching full time. So while I was practicing, it was such an amazing, wonderful, huge chapter of my life. I saw women from all walks of life, women of different ages. When I was early in practice, the women that I saw with breast cancer were older, in their 50s and older, but as time went on, I started to see younger and younger women. And that really spoke to me. I used to love having the women bring their children in for their treatment. I'm a radiation oncologist, and so radiation treatments only take a few minutes. But to me, it was a really powerful reminder of how important my job was to get these women healthy again. Because when mom's not doing well, oftentimes families can fall apart, and it's just so important to get these young women healthy so that they can raise their own children. And so these are actual breast cancer patients with their children, such beautiful, beautiful women. So what I'm going to cover tonight is the scope of the problem. We're going to look at the risk factors for breast cancer. We're going to talk about early detection. We're going to look a little bit at genetics. We're going to talk about overweight and obesity and how that affects breast cancer. We're going to cover food and lifestyle, and I'm going to put the issue of soy to rest. There's a lot of concepts about soy. Most of them are not true, so I'm going to review that for you tonight. So let's start with the scope of the problem. Breast cancer is the most common cancer in women worldwide. So in the United States, 1 in 8 women will develop breast cancer sometime in her lifetime. So that's about 12% overall. If we look at this year, 2017, over 250,000 new cases of invasive breast cancer will be diagnosed. When I was first practicing, it was about 90,000 new cases every year. So the incidence of breast cancer has really climbed. Over 63,000 new cases of non-invasive breast cancers will be diagnosed this year. And breast cancer will be responsible for more than 40,000 deaths each and every year. So most women with breast cancer actually do well. They're treated, they end up being cured, and they live out their lives very normally. However, there obviously are women who don't do well with breast cancer. It's a disease that we can also see in men, although it is very rare in men. In the almost 30 years that I practice, I only saw a handful of men with breast cancer. They tend to be more advanced in men simply because men are not expecting to develop breast cancer. So let's look at the risk factors for breast cancer. All women are at risk for breast cancer. In fact, I put this photo up. It's a stock photo, but it's a reminder for me to share with you that my youngest patient with breast cancer was only 17, and she was about 100 pounds overweight, and sadly, she did pass away from breast cancer. So it's something that we occasionally, very rarely will see in teenagers, but it's not that rare in women in their 20s and 30s. The median age for breast cancer is 61. That means that 50% of women will be older than 51 or 61, and 50% of women will be younger than 61. Women who started menstruating early and who went into menopause late have a slightly higher incidence of breast cancer because of that prolonged estrogen effect. Women who did not breastfeed their children or had their first child after the age of 30 or did not have a child, those women are at higher risk for breast cancer. Women who choose to, who opt for hormone replacement therapy have a slightly higher risk of breast cancer. If a woman has a first-degree relative with breast cancer, a mom, a sister, or a daughter, she has twice the risk of developing breast cancer. If she has two of those relatives with breast cancer, her risk of developing breast cancer is 3 times as high. But one of the real culprits for breast cancer is our body weight. So women who are overweight, by definition, a body mass index of between 25 and 29.5, are 1.5 times higher risk, have a 1.5 times higher risk of developing breast cancer than women who are at a healthy weight. Likewise, women who are obese with a body mass index of 30 or greater are 2 times higher, have a 2 times higher risk of developing breast cancer. And I love this story of Tina. Tina lost her mother to breast cancer when Tina was 12. And Tina became the grocery shopper for her 9-year-old sister and her 16-year-old brother. You can imagine what a 12-year-old is buying at the grocery store. So from the time Tina was in junior high, she was obese. She lost over 90 pounds. And not only does she look fabulous, but she has drastically reduced her risk of developing breast cancer because of the family history. So it's really important to get to that healthy weight. So what's with the weight and breast cancer? Women who struggle with weight have higher circulating estrogen levels. We call that estrogen dominance, and that's the precursor for breast cancer. Our own body fat is the largest source of estrogen in postmenopausal women, and the same is true for the development of uterine cancers. So again, very important to achieve that healthy weight. Let's talk about early detection. Many people talk about mammography as a prevention. Of course, it's not prevention, it's early detection. And the important thing about mammography is that the cancers that are diagnosed on mammography tend to be smaller and they have a lower incidence of lymph node involvement. So they're much more curable cancers. And that's why it's important for mammography on a routine basis. it is recommended for women who are 40 years of age or older. What about MRIs? MRIs are much more expensive. They can cost $1,000 or more as compared to $100 for mammography. So they're not routinely used except for women who have dense breast tissue that's not easily deciphered by mammography, younger women, and those who are the BRCA gene carriers. So we'll move on to genetics and the BRCA1 and 2 genes that we also call the BRCA genes. Only 5% of breast cancers are actually attributable to these genes. So they affect less than 1% of the general population, and they affect about 2% of Ashkenazi Jews. But in the women that are gene carriers who have these BRCA genes, they have a significantly higher risk of developing breast cancer, a 50 to 60% higher risk. And some of these women end up opting for prophylactic mastectomies. Angelina Jolie was one such person. I recommend a meticulous attention to diet and lifestyle instead of the surgery, and then careful screening. So the field of epigenetics is a newer field of medicine, and what this field is teaching us is that our genes actually play a small role in causing cancer and other chronic diseases. It's actually not what our genes do to us, it's what we do to our genes. And we can actually turn genes off or on depending on various conditions and circumstances. So how can we turn genes on or off? And a perfect example is that of smoking. If we do have a genetic predisposition to cancer and we choose to smoke, then our probability of developing lung cancer, for instance, is going to be significantly higher. If we have that genetic predisposition and we never smoke, then the probability of developing lung cancer is virtually zero. Radiation exposure, women who had the chest irradiated for Hodgkin's disease when they were young have a higher incidence of breast cancer. Stress hormones, cortisol and insulin can predispose us to cancer and turn those genes on or off. Pesticides, chemicals, and certainly our diet and our lifestyle. And the wonderful thing about knowing this information is that it's empowering. So if we have control over our diet and our lifestyle, we can do something about it. If we believe that cancers are caused by our genetic background, then we play victim. So it's empowering to know that we have control over a lot of these things. So let's talk about some of the carcinogens, the known carcinogens that are out there. Chemicals from plastic bottles. There's not enough talk about these, but all plastics may leach chemicals when they're scratched or heated. And the chemical from plastic bottles is BPA. It's a weak synthetic estrogen, which is also described as a hormone disruptor. And we know how breast cancer is tied to hormones. So these hormones can induce breast cancer development and growth. We all have cells in our bodies that have the potential to develop cancer. And some of these chemicals can be the cancer promoters. The other thing about plastic bottles is that they are harmful to the environment. There are some countries around the world where plastic of any kind is not allowed. So we want to pay more attention to our environment for sure. It's really important to drink out of glass bottles, stainless steel, ceramic bottles, instead of reaching for the plastic bottles and then not only harming ourselves but also the environment. If you do drink from a plastic bottle, make sure that the bottom says BPA free. So it has this symbol BPA with a red circle and a line through it. You should never cook in plastic containers or even use plastic roasting bags. So let's talk about heterocyclic amines. These are toxic chemicals that are formed by cooking animal proteins at high temperatures, whether it's chicken or beef or pork, it doesn't matter. Animal proteins can form these chemicals, and these are chemicals that damage DNA and also initiate and promote cancer growth. This study from the Long Island Breast Cancer Study, published in 2007, showed a 47% higher lifetime risk of breast cancer in women that routinely ate grilled, barbecued, and smoked meats. This chemical is also found in cigarette smoke, and it can be detected in breast milk. So if it's detected in breast milk, then the baby is getting the same chemicals. So let's talk about the importance of sleep. We know that sleep is a habit of health, and sleep is so important for healing and restoring cells and tissues within our body. But also, as it gets dark every night, our pineal glands, that little gland in the kind of the third eye location of your brain, begins to secrete melatonin. Melatonin is a hormone that regulates sleep, but it's also a hormone that inhibits tumor growth and development. And there are studies that show that night workers, nurses, for instance, that work the night shift, have an increased breast cancer risk, as much as a 40% increase risk of breast cancer, because melatonin secretion is disrupted. So we want to get healthy sleep. So let's talk about exercise. And this is one of my favorite topics because I love to exercise. It's a really important part of my life. I do it every morning. But this nurses' health study on 3,000 women, all of whom had breast cancer, stage 1, 2, or 3 breast cancer, the women who exercised 3 to 5 hours per week had the lowest risk of death from breast cancer. If they exercised more than 5 hours a week, the risk was similar. So in other words, you don't have to do crazy exercise to get the positive benefit of exercise. And I also want to mention that even though exercise is very beneficial, it improves our immune system and has other benefits such as an increase in blood flow, for instance, it's not particularly effective for weight loss. In this study from Time magazine, it showed that a person would have to run 33 miles to burn 1 pound of fat. So exercise is important for other things, for toning, for maintaining weight, for, again, boosting the immune system and improving blood flow, lowering the risk of breast cancer recurrence, but not particularly good for weight loss. So more on exercise. This meta-analysis of 70 studies on lifestyle and breast cancer showed that exercise reduces the risk of death from breast cancer by 40%. However, only 13% of the women in this study actually achieved the 30 minutes a day, 5 days a week. So what happens when we exercise? Circulating estrogen levels are lowered by 20% if we exercise those 5 hours a week. And you already heard that circulating estrogen levels is one of the precursors for breast cancer. So walking about an hour a day, but you have to work yourself up to a bit of a sweat for the exercise to count, is really an important habit to develop. So let's move on to diet. One of my favorite authors is Dr. Joel Fuhrman. And when I was practicing medicine, I used to recommend his book to a lot of my young patients, the book that's titled Disease Proof Your Child, because these women would come in and they would be talking about their children having chronic ear infections and repeat upper respiratory infections. And this wonderful book, Disease Proof Your Child, not only teaches you how to feed your child, but it's the way the whole family should be eating. So health is a complicated issue. All the causes of cancer and other diseases are not presently known. A variety of external factors interact with genetics. Nevertheless, the preponderance of evidence demonstrates that superior nutrition can almost always overwhelm a family history of cancer. The vast majority of diseases are still avoidable. So a quote by Dr. Fuhrman. So what should we be eating to reduce our risk of breast cancer and other chronic diseases? Fruits and vegetables, berries, whole grains, nuts, seeds, beans, other legumes such as lentils. So this is the anti-cancer diet. This is the anti-heart disease diet. This is the anti-Alzheimer's diet. It's all the same, no matter what the disease is. People do not decide their futures. They decide their habits, and their habits decide their futures. So our habits determine what diseases we will ultimately develop, and our habits will determine other factors such as longevity. But we can reverse some diseases with our diet and our lifestyle, and we certainly can prevent most of the chronic diseases. So let's talk alcohol. In 2010, the World Health Organization classified alcohol as a definitive breast carcinogen. Regarding breast cancer, no amount of alcohol is safe, with the exception of red wine, where there's been no reported risk for modest amounts of red wine. And so the toxic breakdown product in alcohol is acetaldehyde. The Harvard Nurses Health Study showed that even one drink a day equated with a small increase in breast cancer risk. Again, with the exception of red wine, and that's not the whole bottle of red wine, but maybe 1 or 2 glasses. And the reason why red wine has not been shown to be at risk for breast cancer is possibly because of compounds in the skins which suppress estrogen synthase used by cancer to create estrogen. So that's the mechanism of action. So let's move on to low-fat meals. And for those of you that remember the restaurants, Fuddruckers, there are hardly any of these restaurants left, I think because most of the people who used to dying at Fuddruckers have probably died of heart disease and high cholesterol and other chronic problems looking at this picture here. So the WINS trial looked at over 2,400 postmenopausal women. They were randomized to a 40% fat diet versus a lower fat diet of only 20%. The women who consumed the low fat diet in this particular study had a 24% decrease in breast cancer recurrence at 5 years. If the breast cancers were estrogen receptor negative, the benefit was even greater, a 42% reduction in breast cancer recurrence at 5 years. So let's move on to plants. I am a big advocate of a plant-based diet, as many of you know. This particular study looked at 1,500 women, and those who consumed 5 or more servings of fruits and vegetables every day and walked for 30 minutes every day, 6 days a week, had a significant survival advantage. At 2 years, they were less than, their risk of dying of cancer was half that of people that consumed less than 5 servings of fruits and vegetables a day. So going back to the topic of animal products, one of my favorite books of all time is the China Study. The China Study was published in 2005 by T. Colin Campbell, a PhD researcher from Cornell University. I see Dr. Campbell every year at the Plant-Based Nutrition Conference that was in Anaheim just a few weeks ago. And Dr. Campbell showed in this amazing book a strong association between animal foods and cancer. Blood cholesterol was actually the strongest predictor of cancer risk. As cholesterol levels decreased well below 200, cancers of the liver, rectum, colon, lung, breast, stomach, esophagus, and brain decreased dramatically. So what we eat matters, and what we feed our children matters. So talking more about obesity and breast cancer, women who are overweight or obese have higher insulin levels. And in this review article of 40 studies, breast cancer was 16%, the risk of breast cancer was 16% higher in women who had diabetes. So for every 11 pounds gained in adulthood, we increase our risk of breast cancer by 11% for every 11 pounds that we gain. Also, women who are obese and who are diabetic have a higher incidence of recurrence, and they also have a higher death rate. So our weight matters, our the diseases that go along with weight matters, the food that we feed ourselves matter. This study looked at 30,000 postmenopausal women. They were followed for 7 years. None of these women had a history of breast cancer. And in women who limited their alcohol, one or two drinks, who ate mostly plant-based, and who maintained a normal weight, those women had a 62% reduction in breast cancer. So again, our weight matters and our lifestyle choices matter. So let's move on to one of my very favorite topics, and that's the topic of soy. And I want to put the misconceptions about soy to rest tonight with this talk. So why people get so concerned about soy and breast cancer is because of the phytoestrogens, the natural plant hormones in soy. These phytoestrogens are also called isoflavones. So anytime you talk about estrogen and breast cancer, there's a fear that goes with it. And so people have been concerned that these plant estrogens may cause breast cancer, may affect breast cancer in some way, and may possibly interfere with tamoxifen, which is an anti-estrogen medication that is often prescribed to breast cancer patients. So I have a couple of studies to show you. The Shanghai breast cancer survival study followed over 5,000 women, all of whom had a history of breast cancer. They ranged in age from 20 to 75 years, and they were followed for 5 years. The women who consumed soy had a significantly decreased risk of death, and they had a lower recurrence from their breast cancer, regardless of whether their breast cancers were estrogen receptor positive or negative, regardless of whether the women were on tamoxifen or they weren't on tamoxifen. So these are Chinese women with better survival rates, lower recurrences if they ate soy. So let's look at American women, because I've shown that study to people, and I've been criticized saying, well, Chinese women living in China are different than American women living in the United States. This is a very recent study that was published in the journal Cancer in June of this year, June of 2017. This study followed over 6,000 women, all of whom had a history of breast cancer. They were followed for 10 years. Those that were in the top 25% of soy consumption, so those who ate the most soy, were 21% less likely to die of any cause compared to those who ate the least soy, or women who did not consume soy. And this was a very diverse study. 17% of the women were Hispanic, 12% were Black, and these are populations that are known to have a poorer prognosis, poorer cure rates from breast cancer. 11% of the women were Asian, but these were Asian Americans, so their intake of soy was lower than normally seen in Asian countries. There was no detrimental effect in women who had estrogen receptor positive tumors. So again, the ones that ate the most soy did the best. This is a study on 5 additional, this was a study on 5 studies on breast cancer survivors and the issue of soy. The women who consumed soy lived significantly longer, and they had a lower recurrence rate. And the soy consumption was modest. Even consuming the equivalent of 1 cup of soy milk per day resulted in a 25% lower recurrence rate. Again, regardless of receptor status, regardless of age, regardless of whether they were on tamoxifen. So my final thoughts on soy is that soy foods help to prevent breast cancer. Women who already have breast cancer can benefit from soy. And the reason why is soy has fiber. It also has these phytoestrogens called isoflavones, and genistein, one of the isoflavones in soy, interferes with cell growth and cell proliferation. It actually has anti-angiogenesis effects. Other benefits from soy: prevention of high blood pressure, diabetes, cardiovascular disease, and the strongest protection against breast cancer is when women start to consume soy as children and during puberty. So what else besides soy does not increase breast cancer? Infertility drugs, coloring your hair, antiperspirants, breast implants, prophylactic surgery. Women have enough to worry about, and they don't have to worry about some of these fake things that are out there. So how to lower breast cancer risk by 30%? Just 6 things. Avoid smoking, drink very little alcohol. If you do choose to drink, choose red wine, because there doesn't seem to be a correlation there. Maintain a healthy body weight. That's super important. Consider skipping the hormone replacement therapy. There's a slightly higher incidence of breast cancer in women that choose hormone replacement therapy. Exercise daily for 30 minutes and eat mostly plants. And I am going to check the time here. So we're getting short on time. I want to make a plug for the OPTAVIA coaches that are out there. Coaching is all about loving and supporting and guiding our clients and our patients without judgment. We walk alongside our clients. We believe in people before they believe in themselves. And as I mentioned, getting to a healthy weight is so very important. The community of support that we offer with our OPTAVIA community is extremely important. Facebook pages, support calls, webinars like the one I'm doing tonight, events. But at the end of the day, we're giving people hope. We're holding them accountable. We're providing a safe haven. We're educating women, and we're definitely caring about them. We care about them with patience and with compassion. We meet people where they are. I used to be very judgmental about people that struggle with weight. I no longer am, because we all struggle with something as human beings. And so we help people through with baby steps. We celebrate their successes. We ask a lot of questions and listen, and we help people create the best version of themselves. So my recipe for a healthy and happy life: eat good food and move your body. Get yourself to that healthy weight and maintain it. That is so crucial. Embrace the scale as your friend. The scale doesn't judge you. It doesn't criticize you. It simply tells you the truth. Don't avoid the scale, because if you do, sometimes people avoid it, and then when they get on, they're 30 or 50 pounds heavier. Get on the scale once a week and use it as a tool to maintain. Read good books. Turn off the television. There are so many more good things in books than there is on the television. Hang out with positive people. You become the people that you associate with. Create relationships and love other human beings freely. Adopt a pet. These are my 2 cats, and I actually have a third one, Callie, who is not shown in this picture. And hopefully adopt that pet from a shelter. There are so many animals that need a good home, and they can provide us with so much love. Seek help from a health coach. There are wonderful OPTAVIA health coaches out there. I'm a health coach, but many of the people on who invited you to the webinar are health coaches, and they are out there wanting to help you create that best version of yourself. And this is my last slide. My children have always been my reason why I have paid attention to my health, why I've paid attention to food choices, why I've developed good habits. I'm not perfect by any means, but my children keep me in focus, and they've learned habits because I've modeled that for them. So thank you very, very much for coming to the webinar tonight and for inviting others. It's been my honor and my privilege to present this information.
The following audio may have contained the personal testimonials of some OPTAVIA coaches or clients of OPTAVIA. The results relayed in these messages are based on the unique experiences of the participants, and we cannot guarantee like or similar outcomes. While you may be inspired by these accounts, please note that any stories of success have not been verified, and your individual path to optimal health will vary. As always, it is our recommendation that you consult with a healthcare provider before starting a weight loss program. Yours in health, the OPTAVIA team.